Hi, Dr. Willie here with the Metabolic Clinic of Idaho. The title of this little presentation is The Membership Revolution: Why Cash-Based Healthcare is Medicine's Bright Future. Imagine this. You wake up one morning feeling off again. For every morning over the past few years, you just haven't felt that well. Maybe that lifestyle is catching up with you? Who knows? You wish you knew how to fix it, though, and improve your quality of life and enjoy more living and just wake up feeling good for once. You need to do something about it. This is not the way to live. But you're also not a dummy. You know that your insurance plan won't pay for health. They only bandage disease. If you want help, you need something outside the traditional reactive Western medicine model. What if you joined a health plan that responds in minutes, gets you in the same day if that's what's needed, and not in a waiting room full of sick people? You can pop into their office that afternoon with no waiting room full of frustrated patients and see your doctor. There won't be the stack of forms to fill out, no surprise bill 6 months to a year later. Just straightforward care with the emphasis on optimal living. Sound like a dream? Actually, it's not. It's reality. And it's becoming the reality. It's cash-based healthcare membership plans. This model isn't just an alternative. It really is and can be the future of medicine. Let me break it down for you just a little. First, let's face the ugly fact and truth about our current system. Traditional insurance-driven medicine and healthcare is broken. It's a bloated bureaucracy where doctors spend more time on paperwork than with patients. In the USA alone, administrative costs eat up nearly a third, if not more, of every healthcare dollar. And what about the patients? They're treated like claim numbers, not people. And the costs? Oh my gosh, it's ridiculous. Premiums skyrocket year after year. Yet out-of-pocket expenses all skyrocket. Families are one illness away from financial ruin. It's unsustainable. We built a system where incentives are malaligned. Insurers profit by denying claims, hospitals by overtreating disease states, not fixing, just treating, and patients suffer in the middle. What if we could prevent illness in the first place? That's a concept, huh? You never have to worry about using the crooked system if that was the case. There is an alternative. Say hello to cash-based membership plans. Think of it kind of like your gym membership, or maybe a membership to Netflix, a Netflix subscription. For a flat monthly fee, you get access to the best functional and integrative preventative doctors available. No insurance middleman, no co-pays, no unexpected bills later. It's just you and your doctor and medicine. Why is this the future? Number one, affordability and accessibility. These plans cut out the insurance overhead so doctors can charge less. Let me give you an example. In my own clinic, when I see someone, I do a very detailed lab review, and that can cost, if insurance is billed, anywhere between $1,800 and $2,200. And if you haven't met your deductible, that's a hell of a lot of expensive blood. So if we do it through a membership model, that same lab panel is $300 to $350. You heard me correctly. Top level, $350. There was a study in the Journal of the American Board of Family Medicine that showed that direct primary care patients save a tremendous amount, 20 to 50% on overall healthcare costs. And that's still reactive medicine. It's not proactive medicine preventing diseases in the first place. The second reason is, with a membership-based program, you have a better doctor-patient relationship. In a membership model, physicians cap their patients as a general rule. That means longer visits. 30, 60, 90-minute visits instead of the average 7-minute visit that I used to get when I worked for a hospital. Doctors have time to listen. We have time to dig deeper. We have time to discuss and prevent issues before they appear, or if they're there, before they escalate. It is meant to be personal, proactive, and humane. I've seen this firsthand. I recently switched to a cash-based practice, and I know I am much happier, and I think my patients are too, and more engaged, because all that crazy stuff we don't have to deal with. Reason number 3, this is very innovative and is scalable. This model is growing like crazy. There's big companies out there like One Medical, and I think another one's called Forward, that are combining memberships and tech apps for virtual visits, for health, AI-driven health tracking, by the way, which we incorporate in my practice as well. And it's not just for the wealthy. These membership programs are way cheaper than high deductible insurance plans and actually do something for you. They change your quality of life. Critics could easily say, well, what about emergencies or surgeries? That's a very fair point. And it's important to know that these plans aren't all or nothing. They complement insurance for big ticket items like a safety net, if you will, under your subscription. But for the 80+% of your healthcare that's primary and preventative, memberships win every time. The future of medicine isn't coming. It is here. There are states passing laws to support direct primary care like a membership program. Employers are offering it as a benefit to cut costs and boost employee satisfaction and health and productivity. By 2030, I think it was expected that membership models could cover 25% of Americans. Why? Because it aligns incentives. Doctors focus on health outcomes and not billable codes. Patients get value, not vouchers. So what's your role in this future? If you're a patient, I highly encourage you to seek out a membership practice. You deserve a healthcare system. We deserve a healthcare system that's efficient, equitable, and effective. Cash-based memberships deliver that. They're not a fad. They're the evolution medicine needs. We still need our Western medicine interventions for when there's an accident or a problem. But there are so many things we can prevent and we can stay on top of and optimize quality of life in this type of model. That's why it's the future. I'm Dr. Warren Willey with the Metabolic Clinic of Idaho.